Hello everyone and welcome back to the channel. I am so glad you're here with me today. What we're looking at is a patient who came in with multiple blackheads on and around the ear, specifically in the concha, the tragus, and the surrounding skin. Now, the ear is actually one of those areas that people often forget about in their skincare routine, but it's incredibly prone to these types of blockages because of the natural oils our skin produces and the unique anatomy of this area. Today, I'm going to walk you through this extraction procedure step by step, explain exactly what's happening beneath the skin, and share some tips on how to prevent this from happening. So let's dive in. What we're dealing with here are open comedones, commonly known as blackheads. Now let me explain what's actually happening at a cellular level, because understanding this will help you prevent them. A blackhead forms when a hair follicle becomes clogged with a combination of sebum, that's the oil your skin naturally produces, and dead skin cells. Every single one of us sheds thousands of skin cells every day, and normally those cells slough off without issue. But when they mix with excess oil, they can get trapped inside the pore. Now here's the interesting part. Blackheads aren't black because they're dirty. That's a common misconception. They're black because when that plug of oil and dead skin is exposed to air at the surface of the skin, it undergoes a process called oxidation, similar to how an apple turns brown when you leave it out. The melanin in the dead skin cells also darkens, contributing to that characteristic black color. The ear is particularly vulnerable to blackheads because the skin here produces a lot of sebum. The folds and curves create areas where dead skin can accumulate. And frankly, most people just don't cleanse this area as thoroughly as they do their face. If you're learning something new today, go ahead and hit that like button. It really helps the channel grow, and it lets me know you want more educational content like this. Alright, so let's talk about technique. You can see here that I'm starting by using a lancet, that's a very fine, sharp, sterile needle, to gently puncture the surface of these blackheads. Now, why am I doing this? The reason is that some of these comedones have a very thin layer of skin that's grown over the opening of the pore. By creating a tiny opening, I'm allowing the contents to be expressed more easily and with less trauma to the surrounding tissue. This is much gentler than trying to force out a clog through intact skin. Now I'm switching to my comedone extractor. This is a specialized tool with a loop or cup-shaped end, and it's specifically designed to apply even, controlled pressure around the entire circumference of the pore. This is so much safer and more effective than using your fingers, which can apply uneven pressure, damage the surrounding skin, and potentially push bacteria deeper into the tissue. Watch as I position the extractor around the blackhead and apply gentle, firm pressure. You can see that dark plug of oxidized material beginning to emerge. The key here is patience. I'm not forcing anything. I'm simply encouraging the natural expression of this buildup by applying pressure evenly around the follicle. There we go. You can see that satisfying release as the contents come out. Some of these plugs are quite firm and solid because they've been compacted in the pore for quite some time. Now we're moving to a larger lesion here. This appears to be either a very deep blackhead or possibly a small epidermoid cyst. You can see it's more substantial than the others we've treated so far. For this one, I'm using a combination approach. First, I've made a slightly larger incision to create an adequate opening. Then I'm using my extractor with more sustained pressure. What's coming out here is that characteristic yellowish-white material. This is a combination of keratin, which is a protein that makes up skin cells, along with sebum and cellular debris. The reason this particular extraction takes a bit more work is that the material has been compressed in the follicle for a longer period, making it more solid and adherent to the pore walls. You can see I'm working carefully to extract it completely. It's important to remove all of this material to prevent it from simply refilling. And there's that satisfying moment when the entire plug comes out intact. I'm immediately cleaning the area with a sterile cotton swab to remove any residual material and to assess the extraction site. If you're enjoying this detailed walkthrough of the procedure, don't forget to subscribe and hit that notification bell. so you never miss a new video. Now I'm systematically working through the tragus and the skin surrounding the ear. The tragus is that small, pointed, cartilage-covered flap that partially covers your ear canal, and it's absolutely notorious for developing blackheads. Why? Because the tragus has a high concentration of sebaceous glands. Those are the glands that produce oil. Plus, this area often gets overlooked during cleansing, and products like hair gel, hairspray, and even headphone oils can contribute to pore congestion here. You can see I'm using the same technique. Puncture with the lancet to create an opening, then use the comedone extractor to apply controlled pressure. Each of these small blackheads releases that telltale dark plug. Some are softer, some are more solid. It really depends on how long they've been developing and the individual patient's skin composition. I'm taking my time with each one because rushing this process or applying too much force can cause bruising, broken capillaries, or even scarring. The goal is always to achieve the best result with the least amount of trauma to the skin. We're in the final stage now. I'm doing a thorough inspection of the entire treated area, looking for any remaining blackheads or incompletely extracted material. This is such an important step. If even a small amount of the plug remains in the pore, it can serve as a nidus for reformation. You can see the skin is slightly pink and irritated, which is completely normal after this type of extraction. That redness will subside within a few hours to a day or two. I'm doing a final cleansing with a sterile cotton swab, making sure the area is completely clean and free of any debris. And there we have it. You can see the dramatic difference. All of those dark, clogged pores have been cleared, and while there's some temporary inflammation, this patient's skin is going to look and feel so much better once it heals. Now let's talk about aftercare and prevention, because this is crucial information whether you've had extractions done professionally or you're just trying to prevent blackheads at home. Immediate aftercare. After a professional extraction like this, the skin needs some TLC. I typically recommend keeping the area clean with a gentle, fragrance-free cleanser and avoiding any harsh or irritating products for at least 24 to 48 hours. The extraction sites are essentially tiny wounds and they need time to heal. Prevention strategies. To prevent blackheads from forming or returning, here's what I recommend. First, cleansing. And I don't just mean your face. Remember to cleanse behind and around your ears as part of your daily routine. Use a gentle cleanser with your fingertips or a soft washcloth, and don't forget this area when you're in the shower. Second, exfoliation. Incorporating a chemical exfoliant containing salicylic acid 2 to 3 times per week can be incredibly effective. Salicylic acid is oil-soluble, which means it can actually penetrate into the pore and dissolve the mixture of oil and dead skin cells that leads to blackheads. A concentration of 0.5% to 2% is typically appropriate for most skin types. Third, retinoids. If you're already using a retinoid for anti-aging or acne treatment, the good news is that these products also help prevent comedones by increasing cell turnover and preventing dead skin cells from accumulating in the pores. Fourth, don't forget about your ear specifically. When you're applying your skincare products, extend them to the ear area. A lightweight, non-comedogenic moisturizer can actually help regulate oil production. And don't skip sunscreen on the ears. Yes, you can get sun damage and skin cancer on the ears. And here's a really important point. Please don't attempt this type of extraction at home. I know these videos can be satisfying to watch, but trying to replicate this without proper training, sterile technique, and appropriate tools can lead to infection, scarring, and damage to the delicate skin of the ear. If you're struggling with persistent blackheads, see a board-certified dermatologist or licensed esthetician. If you found these prevention tips helpful, smash that like button and consider subscribing for more evidence-based skincare education. So there you have it, a complete look at the extraction of multiple blackheads from the ear, along with the science behind why they form and how to prevent them. I hope this video was both educational and satisfying for you. Remember, good skincare isn't just about your face. It's about treating your skin as the complete organ system that it is, including those often neglected areas like the ears, neck, and chest. Thank you so much for watching. If you have questions or topics you'd like me to cover in future videos, please leave them in the comments below. I read every single one. And of course, if you enjoyed this content, please like, subscribe, and share it with someone who might find it helpful. Take care of your skin, and I'll see you in the next video.